For some participants, who are joining us for the first time, just a recap. VOICE is the abbreviation of Voices of Impact in Cancer Equity. It's a project initiated by Aortic and Global Focus on Cancer in collaboration with other African organizations to strengthen advocacy efforts for equitable care in women's cancer in Africa. So there are the steering member committee. So to recap, the voice consists of a series of webinars. The first one, it was an introduction to voice and foundation of advocacy, launched the voice initiative and its goal. We highlighted the role of lived experience and community action in shaping cancer advocacy. The second one happened in June, was about understanding and influencing the policy landscape. We provided tools to analyze national cancer control policies and explored how to identify and act on policy windows for impact across Africa.
Ella,
Today,
I'm sorry,
what we expect?
we can't see your slides.
No,
I
we
have to share
can.
again?
No, we can see them. I can see.
I can see
Yes.
them too.
Is it
Yes.
for everyone?
So, yes,
Yeah.
yes.
Okay. So what we expect today is for this webinar is to understand the importance of stakeholder mapping in cancer advocacy, to identify both traditional and non-traditional stakeholders in the national cancer control landscape, learn practical mapping technique to analyze stakeholder power, interest, and influence, to explore effective strategy to engage case stakeholders, especially people with lived experience, and to reflect on real-world case studies to inspire action and contextual relevance. So I am pleased to moderate this webinar with my colleague, Dr. Samiratu Ouedraogo, and we are so happy to have with us as a speaker, Dr. Zainab Bagudo, Professor Nesrine Meji, Dr. Sharon Kapambwe, Ms. Mishka Koli, and Dr. Alfred Karago. So we will start the webinar by some questions. So feel free to put your answer in the chat box. So it will make our webinar more interactive, and we can learn how things are doing in each country. So the first question: how are the most influential stakeholders in your country's cancer policy? I cannot see the chat box. Answers are coming. I don't know if we can see some answer in the chat box or not yet.
There's some.
Yeah. Yeah, Ministry of Health, patients themselves, the government, Ministry of Health, healthcare workers. Yeah. Okay. Survivors, people with lived experience, clinicians, oncologists, Ministry of Finance, yeah. Okay, Ministry of Health and NGO. Okay. Yeah, thank you for your answer. So the second question, so why does stakeholder mapping matter? Violation. You can learn, read some to understand how we need to address to and how I would like our advocacy to be efficient, avoid duplication of effort. Yeah. Make communicate, the collaboration. Yeah, more targeted advocacy message. Okay, to understand how to make use of stakeholder to facilitate implementation of priority activities, knowing how is more active in cancer prevention. Some French answer also. Okay. Okay, so no more answer. Thank you for all participants for your answer. So we will start with the first presentation, and I'm pleased to introduce Dr. Sharon Kapembwe. Dr. Sharon is a global public health physician currently serving as a technical officer of cancer control at the WHO country officer in Uzbekistan, where she leads the development of oncology service project. Previously, she worked at the WHO African Regional Office, supporting cancer control efforts and leading initiatives focused on women cancer service in several African countries. Dr. Sharon, do you hear me?
Loud and clear. Thank you so much. Please go
Yeah,
ahead. You're sharing my slides? Can I share or you share? Okay, thank you.
Yeah, you can share. I stop sharing so you can do it.
You go ahead. Okay, let me go ahead and share.
What do you
Thank
prefer?
Maybe if you're sharing, I'll be faster. Okay.
Okay, I'll do it.
Go ahead.
Okay. Is it okay
Thank
like
you.
this? Yeah.
Yes.
The floor is
Just
yours.
wait. Thank you so much. Thank you for this invitation and just talking about the fundamentals of cancer advocacy. Great to see you all. Bonjour. Good day. First slide. So I think the most important thing that we really want to know, and maybe you have discussed it previously, but it doesn't hurt for us to mention it again. Who is a stakeholder? When we're talking about a stakeholder, we're basically talking about someone with interest or influence. They have to have those two. If they are not, if it's not somebody with interest or influence, they're not actually a stakeholder. And also, to know the process of learning for a stakeholder, we need to understand the process of learning, the perspective and their affiliation and the area which they represent. And in a stakeholder, in a stakeholder, we need to determine the role, power, and position to cancer advocacy and how they'll be able to support successful stakeholder engagement. A stakeholder is either a decision maker or an influencer, someone with influence. And then we've got the issue of power, interest, and position. Power is the ability to influence the making or implementation of a cancer policy, since we're talking about cancer. And it's also somebody with the possession of vital resources, such as finance, networks, political legitimacy, which gives the stakeholder the ability to adopt or reject a policy. So sometimes we're really stuck in thinking someone must have funds, then they are a serious stakeholder. But it could be somebody who has serious network that they will network you to somebody who can actually give those funding. Or it could be somebody with political muscle that they will be able to help you in adopting. But it could be also somebody with the same power to reject what you're putting across. And they also interest is somebody who has benefits or drawbacks on an approach that might bring the stakeholders and therefore willingness to support. So somebody is either they are benefiting or they are going to have a drawback. It will affect how they operate. And when we talk about position, we're really reflecting at their level of support to the policy. Either they are going to be supportive, non-mobilized, neutral, not here, not there, or they're going to oppose you. Next slide. And we need to define the players in the national arena like such. We need to understand that we're basically talking about two audiences. One is the decision maker, your primary audience. Who are the individuals or groups who can take decisions that you want to be taken? Decision makers on cancer are likely to be broadly grouped as follows. It can be government. I saw most people putting government there. For example, is it the president? Is it the prime minister? Is it the health minister? Is it their deputy? Is it the permanent secretary, cabinet secretary? Is it somebody with a budget, finance, planning? Is it somebody who is connected to what we're talking about? It might not be health. It could be Minister of Education. If you're talking about HPV vaccination and school-based, you're talking about education. It could be transport. It could be agriculture, depending on what part of cancer you're talking about. It could be a member of parliament or senate. So just because we're talking about cancer does not make the Ministry of Health the only influential stakeholder that we're talking about. And potential influencers, those are the people with the ability to influence your decision makers. It could be civil society, NGOs, whether formal or informal. It could be opinion leaders. These are religious leaders, traditional teachers, activists, people with lived experience. Those are the potential to influence your decision. And now we must put non-traditional entertainment, sports personalities, social media influencers. There are young social media influencers who are having 4 million followers. We have to learn how to engage that, because even if they say something about a cancer policy which is wrong, and all of a sudden, if they come and say a negative thing about vaccination, for example, HPV vaccination, and they have 4 million people who are following them. It's a sports person who has so much influence. And sometimes you might know this sports person directly. Remember, I said power is about somebody who also has networks. So when we're thinking about stakeholder mapping, we need to be moving in that direction. Stakeholder mapping itself, it's a process, it's a way of implementation that the team has to learn. Again, I mentioned this, it's understanding the perspective of stakeholders, their affiliation. What are they affiliated to? What area are they presenting? Are they advocacy? Are they financing? Are they, technical advice? And what interests and perspective do they bring to cancer control? Next slide. So when we talk about identifying and categorizing stakeholders, we're really putting these stakeholders as stakeholder 1, stakeholder 2, 3, 4. You're doing this stakeholder category matrix, which we can call mapping in a way. So you are having either influence or power is high or low. And then the interest in your particular subject is either low or very high. I get to stakeholder 1, the ones we can call the crowd. It's everybody. Strategy, we just need to monitor, because when you're doing your stakeholder mapping, you are also learning how do we engage these people. Stakeholder 2 type, observers. These are people that we should keep informed. I talked about influencer, maybe she's just an observer, but she has 5 million. It would do good to tell her about your cancer program, however you're going to do it, so that if there's wrong information going on, these are channels that can be used to correct information and they have a wide reach. You have a stakeholder 3 who has high influence, low interest. You can find that some stakeholders, they'll give you money. We are working with a pharmaceutical, highly influential. They've got the power, but they're not going to be in your face on everyday business. Some of them, I'm giving an example. So you find that they can pull the plug and say, hey, you're not doing what we said, but they're not going to be following you every day and what you're doing. Then you get to stakeholder 4, key players. This is where you're putting your Ministry of Health. That's your NGOs, your donors. I didn't see most people put in donors. If you are saying Global Fund, for example, if you're looking at cervical cancer, they are key players. They want to know what you're doing every day. They need a report. They want to know where you're going. How are you using their finances? You have to manage government closely. You have to manage certain donors closely. Some you have to keep satisfied. Keeping me satisfied is giving me information and making sure you're telling me this is what you're doing. Others, you're informing me and you're with me, you're close because I'm a key player. So manage, understand who's your key player, understand who has influence to tilt whatever it is you want. And I talked about the negative ones as well. In the negative perspective, if I say this is a religious leader and they say, no, we're not interested in HPV vaccination, they are influential and you need to also keep them satisfied. We need to learn to engage the negative stakeholders instead of just the positive stakeholders. Next slide. So I got this from a family planning, and I'm not going to go too much into detail due to time. Key thing in mapping, identify your stakeholders. If this was for reproductive health, we can also just put cancer there. We need to know who's having interest in our current implementation of whatever we are doing. It might not be practical or necessary to engage them, but we need to know. We need to understand the level of intensity and what time we should commit to them. And it can change over time. So I give an example of what is going on in the global space. USAID, funding was coming from them, everything. So which means stakeholder mapping has to be monitored over time and try to see who has remained of influence, who should we keep satisfied. If I'm no longer there, you were getting money from this donor, it has ended, another donor has come in space. Do not spend your time where now you should just be keeping informed, not satisfied. Analyze your stakeholders. What do they stand for? Their mission? What do they want out of this? Sometimes we go tangent. You have not understood the stakeholders' desired outcome for what you're doing. And what really motivates them? Who are they? At what capacity do we need to engage them? Map your relationships. And so you see the first column there, it said name of organization, Ministry of Health. We need to know who's the contact person. Let's say WHO, who's the contact person? WHO technical officer, level of influence. Do I really have so much influence? I might have influence. Okay. Here it's written family planning officer. Sometimes I'm the technical officer, but everything is coming on my table, or divide the funding like this and that. And you need to keep me informed, close to you, so that I know what it is you're doing. And it could be the Ministry of Health cancer person who needs to be informed. Type of influence. Okay, we are the ones who are doing the planning. We're the ones who are doing the policies. So if you're desiring to have a policy, you need to keep that person close. Priority of engagement, you need to know. This is an important engagement, but what exactly are you engaging me for? Is it a collaboration? Is it a consultancy? Is this just for my information? So all these things have to come to play. And the role and type of engagement. Do you want me to come and lead your process? Do you want me to be in the forefront? Do you want me just to be continually engaged where you come back, Dr. Kapambwe, can you come and do a presentation, share some information with us? That is what you are analyzing my use. Map your relationship. To map the relationship, what are the objectives of the stakeholder, their role? Consider how each stakeholder may contribute to helping you. Finally, very important, sometimes we waste so much time on stakeholders we should just be keeping informed or at arm's length. Prioritize your level of engagement. Prioritizing stakeholder engagement should be directly informed by your analysis of stakeholder. Remember, there was it, what is this organization's mission? What do they do? What is their capacity to implement? Those with high level influence may be prioritized to engage with at the onset of the implementation. There are people you want at the beginning, people you want in the middle, people you want at the end. There are people you want all the time. So determine, do you need me with you through the process? Do you need me to be highly engaged, or you come and do a webinar and that's all you need from me? Next slide. Please alert me of my time. So that is stakeholder mapping. I want to add something which most people have started adding now, stakeholder analysis. These are together. So most people will start with a stakeholder mapping. It's a visual sense. You have this visualization of who is important, who has high influence, low interest, who has high influence, high interest, who has low influence and low interest. You map them. It's visual. You can see. When we come to a stakeholder analysis, it's the process of systematically gathering and assessing qualitative information about your stakeholder. Categorize their relative importance as actors.
Sorry.
The important thing is to develop strategies on how to involve them. With mapping, you just know these are the people there. With analysis, you have to respond and develop strategies of how to involve them. 2 steps, identify the actors. We've talked about their role, power, and position. You cannot mobilize people unless you ask them to do something. They need to be informed, educated, and what interventions are possible with this stakeholder. Let them know they are part of your solution, whether negative or positive, they are part of the solution. Example, if we introduce HPV testing and you are in a country that has invested in cytology, pap smear is everywhere. You have cytologists, you have everything. Now this HPV test is coming and you're saying, no, the first, we might use it as a triage, but we're not going to, the primary test is becoming HPV testing. Cytologists, government might say, look, do you know how much money we've spent into this? You, as an advocate, will know, look, science is telling us to go this way. So you have to find strategies. You need to get people with high technical knowledge, perhaps to break it down to you, or to indeed invite them to come and talk to government. Instead of just going, no, you need to change to HPV testing. No, and the government is like, why do we need to change to HPV testing? Maybe your capability of having the technical know-how is not as much. Find that stakeholder who can do that. Next slide. I hope I'm close to finishing. Why do we conduct a stakeholder analysis? Because we want to identify groups and institutions that will influence your program. Again, either positively or negatively. A stakeholder analysis anticipates the kind of influence. You're thinking ahead of time. Develop strategies to get the most effective support possible. So if I feel government has invested into cytology, we as advocates want to bring up HPV testing. So you need to be able to already work through what you anticipate. We're going to get a pushback from the cytologists. The professional bodies are going to come for us. The government is going to say too much money. How do we do cost-effective analysis? Who can help you? Think ahead of time of possible things that can come, which are negative or positive, and plan for them. Next slide. Okay, since I'm late, this is just a stakeholder analysis done on governance stakeholder analysis. So it's just people who are governing non-communicable diseases. Justification. What is the justification of you being a stakeholder there? Please go ahead. I think I am chewing into time. And that's the stakeholder power position matrix, which is more like what we did.
On peut voir la position de...
Bonjour. So you look at the power, this we already talked to, but in this one, support, who's supporting us? You are mapping them based on their influence, their power, and their position and interest. You are putting them into support, non-mobilized, oppose. This group will support us. Government will support this. JICA will be neutral. And then you find food industry, because you're talking about non-communicable diseases. They're selling all the sweet things, the sugary beverages, and what they're opposing. And you might find a tobacco company has high influence and high interest, and they are opposing you. Ministry of Finance is getting taxes. They are opposing you. Their government, remember, Ministry of Health is saying, no, tobacco, not at all. Ministry of Finance is saying, hey, that's where we get the money. So you get these. And when you have that, you need to manage. Academia is coming in somewhere. I think the next should be my last slide. Key thing, learn to understand the macro and micro environment in your areas. Consider the political climate as you're doing the stakeholder mapping and the opportunities and the obstacles you might encounter. Sometimes we almost as advocates become so aligned in the view of, okay, we need the politicians to buy in. We forget whether the policies are bad or what. We just become so political that when power changes, there goes your influence, there goes your NGOs. You need to understand your power and the political climate, the opportunities and the obstacles that you're going to encounter. Does this government need convincing? If it does, how are we going to do it? Do we need to convince people at a family level, at a community level? How is this community? Do we need the religious leaders to come in? What is going to, how is the nation going to receive what you are advocating for and plan towards that? Political climate, opportunities and obstacle you might encounter, and plan ahead of time in analysis of what you are anticipating. Thank you so much. Lovely to see you all and to be able to make this presentation. Bonjour, merci beaucoup, tout le monde.
Thank you, Dr. Sharon, for this brilliant presentation, very clear. I don't know if Professor Nasreen already connected. So for the next presentation, maybe we will move the question later. And we will move to the second presentation. And I'm pleased to introduce Professor Nasreen Majri, Assistant Professor in Medical Oncology, Head of Medical Oncology Department in Tunisia, member of the Tunisian Society of Medical Oncology, and board member of African Alliance for Women Global Health in Oncology, and member of the Scientific Committee of Aortic Congress 2025 in Tunisia. Nasreen, are you connected already?
Do you hear me? Yes, I am connected.
Yeah. Do you want that I share for you the screen, or you will do it?
I shared my screen, but I'm not sure if you're seeing it.
Just I stop it.
You see my screen?
Yes. Yes, Dr. Nasreen,
Okay.
we do.
Okay.
So go ahead.
Okay, so this is Dr. Nasreen. I am an oncologist and researcher But also in some projects, I am considered myself a stakeholder. So there is a ambiguity while I'm presenting. And I thank a lot, Mrs. Sharon, for setting the tone. You practically said everything. I just will continue on what you said by giving some practical examples, something from the, you talked a lot about non-communicable diseases. I will talk about lung cancer, which is a huge burden on the healthcare system in my country. So in order to help you better visualize those methods that the Mrs. Sharon shared. So why it is important to do a stakeholder mapping? Of course, all of us work inside some kind of labs. It could be real labs, but in labs, you create things, you research things. So it can be clinical lab in a hospital, lab, biological lab, social lab, anything inside experts. They will create awesome things in order to help the population, help cancer patients, improve cancer care. But if this is only limited to the lab, it cannot be really implemented outside the lab. So who will benefit from these awesome ideas and creations around cancer? If we do not consider the stakeholders that Mrs. Sharon talked about, like decision makers, users, beneficiary, patients, caregivers, etc., if we don't consider them from the beginning of our projects, it will be difficult to implement what we found to those different environments and make these solutions that we are creating more affordable for patients. So this is not only a tool or something that optional, it's a strategic necessity. Every project we are working on around cancer should consider stakeholder mappings from the beginning. You write your protocol, you think about your idea, you create your own research hypothesis and validate it, but hand in hand with that, you have to take into consideration the stakeholders. They will help you implement your solutions and make more impact. So what is the stakeholder mapping techniques? We already saw some of them. There is a consortium, international consortium of implementation science. Implementation science is a science around methods on how to implement new discoveries around cancer and how to make them more impactful. So the consortium reunites like once a year, I think, and they give recommendations, they give guidance to all groups or communities on how to do the stakeholder mapping. They give them some techniques. First of all, we have 3 steps. So it should be clear in our minds, we have 3 major steps. The first step is stakeholder identification, as Ms. Sharon said. It's the creation of a list of potential stakeholders, but this should be an exhaustive list. So we need to analyze the list and make prioritization, which is the step 2, stakeholder analysis and prioritization. The step 3 is stakeholder engagement. Engagement coming from you as a research team or a project team, and also the stakeholders that you identify. So those 3 steps are major steps. You should consider them. For the first step, you will start with the first step, creating a list. And creating a list it's the first step. It's a fundamental step because you should not miss any potential stakeholder. For example, in my project, in the one that I am advocating for right now, is implementing the testing of non-small cell lung cancer in the reimbursement system. Every patient with non-small cell lung cancer should not be treated without a test, but the test is out of reach, it's out of pocket expenses for the patients, and it's not reimbursed yet. We are advocating for that. As a researcher, I worked in labs and we created our technique. We are now familiar with the technique. We can sequence cancer, we can have good reports, we have molecular tumor boards, everything is fine. But now, how to make patients benefit from those discoveries, those new skills that we learned that are possible in our country. So this is the project we are working on, and we had to create a list of stakeholders. We thought about the list. Of course, you have the Ministry of Health, you have the CNAM, which is the reimbursement system. We have pharma, of course, who's selling the drugs, human resources, etc. And in order to make the list exhaustive, you need to follow some steps and some tools, and you need to pay very good attention to that. It's not something easy. You do a small brainstorming and that's it. No, you have to do brainstormings, interviews. We went into face-to-face interviews with many intervenants. You do surveys, you implicate different point of views. You have to have a big vision around the different possibilities in order not to miss a specific stakeholder that sometimes can help you or either be a problem afterwards, create you problems and you missed that from the beginning. So this list should be really, really exhaustive. You should put anyone that you can think of in your list. So for example, in our project, this is the list that we identified. Some of them are important, some of them are not. We don't know every single one of them. So what to do with this whole list that we created? Here comes the second step, which is the analysis and the prioritization of the list. You have to know those stakeholders. Who are they? What is their position? So you have to follow some criteria like these. The influence that's talked about Ms. Sharon earlier, the influence. How is influential this person? The Ministry of Health is decision maker, so it's very, very influential. What are their interests? What will they gain from your project? Is it interesting for them? This is a very important factor in order to consider when classifying and analyzing your stakeholders. Of course, the impact, the legitimacy, the criticality, I mean. What do I mean by that? For example, the pharma who is selling the drugs are offering the test for free with the drug. So this is a possibility. So we can say, we can accept the pharma, but is it legitimate for a country to accept that pharma controls the testing? What if you have a problem with pharma? So what will happen to the testing? What will happen to the patients? It's the Ministry of Health, the authorities, local authorities, that should be responsible for the testing, not the pharma. So the legitimacy of the pharma goes down and the Ministry of Health goes up. The position, are they in favor or against your ideas, and the effort needed. Some stakeholders need to do a lot of effort, so you have to be aware of that. Others that just need some push to your project, and that's it. So based on all those factors, you can do an analysis of your stakeholders. This is something that can be done automated. Some companies sell this service. You give them the list of your stakeholders. They know the ecosystem, and they have the charts like these offered. But we don't have access to those platforms. You don't have a lot of money, so we can do this by ourselves. No one knows our ecosystem better than us, so we should invest in this and do it ourselves. Now, this was shown by my colleague earlier. Once you have analyzed your stakeholders based on those major factors, especially influence and interest, you can have this grid. And this grid here you put the people, the stakeholders with high interest and high influence. Here, the low interest and the low influence, and so on for the rest of the boxes here. And I put these like this. This should be taken with a pinch of salt. Of course, this is not well analyzed, but let's say we classified the Ministry of Health and the CNAM, which is the payer, as very important because they have big interest and big influence. Pharma, because we don't want them to have anything to do with the testing, we classify them as low interest and low influence. But this can be, of course, discussed. For example, media are people can have high interest in cancer because it's a very social problem, but they cannot really have an influence on reimbursement of testing. So you classify all those your stakeholders based on this grid, and you know what to do with any one of them. For example, with high interest, high influence organizations, stakeholders like the CNAM and Ministry of Health, you need really to manage those people very closely. Those are the ones you should concentrate all your efforts on them. The other people with low interest and high influence, you have to keep them satisfied, because if you get one of them against your project, there is a problem. So you have to keep them satisfied. You have to consider what are their conflict of interest, if it's okay or not. Communicate with them, but you have to put in mind that those people can get you problems if you don't consider them. Media, which is high interest but low influence, for example, you keep them informed. They can give you a push, but not really a big push. So this is an explanation of or an example about a project that I am working on, and repeating what my colleague said earlier. Other grids exist, of course. There is the power predictability risk. Here, you identify the people who may harm your project. It's very important to consider also those stakeholders, and other grids that you can find on internet. You can use them to better tailor your stakeholders and identify them. There is also another map that is interesting, which is the stakeholder relationship map. Earlier, I said, for example, that the Ministry of Health and the CNAM, who will pay for the test, both of them are high interest and high influence. So I should really monitor them. But when we look to the relationship between them here, there is a conflicting relationship because both of them will have financial implications. So the Ministry of Health will pay, also the CNAM will pay, but no one wants to pay more. Every organization is separate, has a different budget management system, so they don't want to pay a lot of money. So when you consider both of them, there is a conflicting relationship between both of them, and you have to consider that and you put it on in your mind. And when you are dealing with one or another, it is possible that you can have some errors in your approach that can cause you problems because you didn't do the relationship map. So the relationship map helps you better understand the whole picture of the relationship between the stakeholders. Now that we classified them, we know who will we be focusing on, who will be keeping informed. Like in a party, for example, you have VIPs that you will invite, you have like your friends, and then the neighbors, you should keep them satisfied, don't do a lot of noise. You see, so you did this classification, this prioritization, and then you move to the engagement part. The engagement part is your engagement and the engagement required by the stakeholder that you identified. And here we have 3 levels of engagement, as we said earlier. If you have low interest people, you just keep them informed and you only offer information. If you have moderate interest, you consult those people, for example, the experts, the human resources, the media, you can consult them, they can help you, they can give you some tips, but you're not really investing a lot of time and you do not ask them to engage a lot with you. And the last level of engagement is collaboration. The collaboration is very important with those stakeholders, the stakeholders with high power and high interest. And collaboration, it's difficult to measure, but you have to be there for the meetings, for the explanations. You have to give them figures, numbers, write things to them, explain everything, raise awareness. You have to be there for them anytime they ask about anything. And this should be your first kind of effort you are doing when you want to convince those high interest, high level stakeholders. And the engagement level can be really increased if you have a strategic alignment with them. What do I mean by that? With their values, I mean. What do you mean by that? For example, the Ministry of Health. The Ministry of Health really wants equity between all the patients in the country. They want the management of lung cancer to be in alignment with international guidelines. So if you can convince them that the testing and personalized medicine is mandatory to make equity everywhere, to make international standards high, to solve a problem, a healthcare problem, they will be more engaged. You have to talk their currency, you know their values and what they are working for, and show them that your project is in alignment with their objective and vision and values. The other, for example, the CNAM, the people who will pay for the organization that will pay for the test, they talk money. So you have to talk to them money. Is it cost effective? You have to do a cost effectiveness study, show them that if you treat with a personalized medicine, give the right treatment to the right patient, it's probably better than give the standard, the broad treatment to everyone, and it will not have as much effective result as possible. You show them the outcome. So you talk their language, you talk their currency in order to convince them, and this will increase their engagement. Of course, patients and caregivers, every stakeholder that you identified speaks a currency, speaks a language, and you need to speak that language in order to convince them. If you do this and you have this in your consideration, you will reduce significantly the decision, the fear of decision. I mean, in any project and any decision, there is someone at the end of the day who will sign the approval of the project, someone. And this someone is taking a big responsibility. And of course, he will have a fear of decision and he will postpone the signature again and again and again. It's your job to make them really convinced, to make the idea clear for them. The priorities are clear, you give them numbers, you are there for them to explain everything in order to reduce significantly this fear of decision and make them sign or approve your project and your ideas faster. So it is very important to talk this, and this slide I think is important, and you need to respond to the others' needs. So I wanted to put boots on ground with the theoretical aspects of mapping the stakeholders in order to better understand the approach. So in order to conclude, a clear stakeholder mapping with exhaustive list will give you a targeted approach and a strategic approach on which you can orient your efforts and dedicate your efforts. When you do the analysis and the prioritization, you have a tailored approach and you have a more effective implementation. And then when you increase the engagement of everyone, you have increased political and operational feasibility of your ideas and or project. So in order to conclude, I think that stakeholder mapping with the 3 steps that we saw earlier and the different tools are not only practical, not just a theory that you may or may not use or something that is not easily implemented. I think that it should be considered from the very, very beginning of any project you want to do. There is a real change and a big area of research around the stakeholder mapping techniques, etc., in order to make people more engaged, because there is a gap between the lab and what is really happening in the real world. For example, in my country, lung cancer is not just a clinical question. It's a systemic challenge that implicates many specialties, many type of patients, different aspects of cancer management. So you cannot solve this by only working on a lab. You need to have a big idea, broad idea about the stakeholders that can have a relationship with your project. And I think this is my last slide. Thank you very much for your attention.
Thank you, Nesrine. Thank you for this excellent presentation. I think that we don't have a lot of time, so we will move to the next presentation, and I have to introduce Ms. Mika. So Ms. Mishka, Sira is a public health advisor in the Partnership and Dissemination Branch Center of Global Health at the National Cancer Institute. Ms. Mishka will present as a case study in Kenya. So I don't know if I will share the presentation or you would like to do it.
That would be great. Whoever's sharing now, that's perfect.
Okay, yeah. So the floor is yours. We are pleased to have you in this webinar.
Excellent. Thank you so much. Thank you very much to everybody, to the organizers for inviting me to speak here. Congratulations on this incredible and very important initiative, the Voice Initiative. And thank you to the speakers who spoke before me, because I think you've set this up really well. My job here is to give, as Dr. Hella said, 2 examples of stakeholder mapping that I've been involved in, just to talk a little bit about, carrying through the conversation that's already been shared about different techniques for conducting stakeholder mapping. So next slide, please.
Sorry, I cannot. Yeah. Oops.
And I'll just say, as you're doing that, so yeah, so I'm also Dr. Alfred Karagu, who's also here, will be sharing additional examples as well, primarily from Kenya. So I'm going to give 2 examples here. One is a report on cervical cancer activity in Kenya that I conducted in 2014 and 2015. I completed on behalf of the American Cancer Society to inform an internal report. And then more recently, the National Cancer Control Plan Development Research Initiative, also known as NCCP Drive, conducted from 2023 to this year, still completing and finishing the publication. And we've been conducting this with the International Cancer Control Partnership. Next slide, please. So for the report on cervical cancer activity in Kenya in 2014 and 2015, as I mentioned, for American Cancer Society, this was to inform internal strategic planning. American Cancer Society was at the time developing partnerships in Kenya and I wanted to get a better sense of the landscape of cervical cancer activity in the country. And so that was the purpose for that stakeholder mapping activity. And so I was living and working in Kenya with many of you who I see here today, actually. So I had the opportunity to already know some of the actors working in the cervical cancer space. And having the trust of working with them, I conducted a series of interviews, first with the contacts that I knew. So that was that inner circle of people I already knew. And through that, I was able to identify, they let me know of additional actors that were involved in this space, be it clinicians, advocates, policymakers, researchers themselves. So I created a series of questions and then circulated in either through interview, or if I wasn't able to interview folks directly, went back and forth over email, and they were willing to provide information that helped me then develop this report for ACS. And the report was laid out by the different programs that institutions led. It was also laid out by the geography across the country of where this was happening, and then also demonstrated by focus area. So on the next slide, you will see I'm not able to provide all of the detailed information because, as I said, this was an internal report for ACS, but I'm just sharing with you here a sample of how we listed the stakeholders. And then through an iterative approach, they would share with me, oh, I'm also involved in this kind of activity, or I'm also involved in that. So I kept building out the list as we kept going. So I ended up with this table here. So you're seeing a crossway, and then down was all the list of institutions, and then the types of activities they were involved in, whether it was screening, HPV testing, treatment. As you can see, HPV testing wasn't highlighted very much. This was 2014. This would be very different today. And also, we did not have social media influencers in 2014, so that was not a category of people that I surveyed. And then all the way through to research. And then as we were going, people were saying, oh, my organization is also involved in providing screening equipment or IEC materials. So we added that as a whole other category. So as you go, many of you may already have done, maybe very experienced in stakeholder mapping, but, and others who are doing this for the first time, you may see that you may need to adapt the questions you're asking even mid-process. Okay, next slide, please. So the other example I wanted to share with you is the National Cancer Control Plan Development Research Initiative, NCCP Drive. As I mentioned, this is in partnership with the International Cancer Control Partnership. And so we, through ICCP, convene a Project ECHO for National Cancer Control Plan implementation. And so what we understand is, through the Project ECHO, we are learning from cancer planners and their country teams on the challenges and strategies around plan implementation. But we understood that there's limited knowledge around actually mapping of what goes into the development of a cancer control plan. So the purpose of our study was to understand these challenges, but also strategies that countries are using in NCCP development in low and middle income countries. This has resulted in a publication that is being submitted almost as we speak. And so we will be able to share the publication afterwards. But what we did is we analyzed these interviews with cancer planners in 9 different countries, 8 of them in the Africa region. And these are the cancer planners based in the Ministry of Health. So these are the technical officers in charge of plan development and implementation. And we asked them questions around what was the inner and outer context of the development process, what was the process itself, what went into the cancer, how did they prioritize pieces going in the cancer plan. And for the purposes today, we also asked who were the actors that were involved in cancer plan development. Next slide, please. So I cannot share with you, again, the whole table. You'll see it in the publication. But what we did was we analyzed, in analyzing the results from these interviews, we took a look at the actors by the type of actors and the ways they were engaged in NCC development. Now, this is as reported by the cancer planners themselves. And again, this is 9 countries, so it's not like a global talk that I'm giving here. So we coded all of these responses iteratively. So based on what the cancer planner said, we then kind of grouped people together into categories. And as mentioned again, more will come out when it's published. So in the green, you'll see the actors that were engaged in NCCP development as reported by the cancer planners. This is in alphabetical order. This is not in priority order. And this is not laid out in that influence chart that was shared by our previous speakers. spoiler alert, patients and survivors and community leaders were the least referenced or reported actor group that was engaged in NCCB development. So that's obviously an area for growth for cancer planners, as well as finance and legal. Those were also categories that were less likely to be reported as engaged in the NCCB development process. And as already reported today, those are also very important areas. And then the ways actors were engaged, based on their technical expertise, it could be capacity building, whether they were working in communities, it might be service provision. So I won't read through all of these in the interest of time. So next slide, I just wanted to share and sort of reiterate what's been said already, but some of the things to consider in the experience I've had in conducting stakeholder mapping is time. And I think that's already been highlighted by Dr. Sharon and Dr. Nazreen, but you really need to allot enough time and resources of your organization to conduct a thorough stakeholder mapping. And it might be that you identify stakeholders that are maybe tangential to your primary objective, but it's also a great idea to keep track of them because who's tangential now might be primary at a later time. So be clear about your purpose as well. So if you are just, all over the place in mapping stakeholders, you may not actually get a really good, clear, rich data. So make sure you're very clear before you set out with intention to map stakeholders, especially if you're going to engage directly with people. And then think through sustainment right from the start. Do you have the capacity to keep this momentum going, and what is your long-term gain? And that can also be influenced by your purpose. Lastly, a few things to remember: trust. So as I mentioned, I had the opportunity to reach out to individuals and institutions I knew. So they trusted me. And so you have to make sure that when people are sharing information with you, just know that they're trusting you to be, good keepers of that knowledge. And so transparency is the next piece. Be fully transparent. If you know you're just giving them a heads up about something, be transparent about that. That's totally appropriate. And if you think that you're going to want to maintain long-term relationships and you say you will, make sure you follow up with that. And so tracking is important. I showed those little grids. I'm a big fan of the Excel spreadsheet. I think that's a great way to keep track of people and institutions, and also just make sure, again, that you're being a good citizen and a good engager with stakeholders. And then that really holds true to what your overall goals are. So best of luck to all of you with all of the work you're doing, and I'll turn it back to Dr. Hella. Thank you.
So thank you, Mishka, for this interesting case study. Very interesting. So I will just, yeah. I don't know if there is some question from participants. Yeah. Okay. So feel free to ask your question in the chat box or to hand your hand up.
Okay. Can I?
Yes, Samira.
Yes, I'm saying that we wanted to take the questions now. I don't know if, because I had questions for the panel discussion with Dr. Karagu, who was supposed to join also. I don't know if we should ask them now and then go ahead, go with the final presentation from Dr. Zenab. Caroline,
Okay.
please advise.
Yes, Dr. Karagu is on. So, Dr. Karagu, would you like to share any of your thoughts about everything that's been going on in your experience?
Yes, I wanted to ask, since with Dr. Mishka, you led this work on the ground and you have experience doing it, how do you engage with high power and low interest stakeholder effectively? How did you do in your context, like practical tips or practical strategies you have used in this work to engage with high power and low interest stakeholders? Because sometimes we have these and we don't really know how to manage them, how to deal with them properly. I don't know if you can share your experience.
Thank you very much for the question, and greetings to everybody. Good morning, good afternoon, wherever you are. My name is Karagu, as introduced, Dr. Alfred Karagu. Currently, I'm working at the International Atomic Energy Agency. But a few years back, I was working in Kenya as the inaugural director of the National Cancer Institute. And I think that's I have followed the discussions. And I really appreciate the previous speakers who have really made the case on the value of our stakeholders. And I really resonated with our first speaker, my friend, Dr. Sharon, who talked about appreciating that they're both positive and negative stakeholders. So going back to my own experience, I worked some years back with Mishka and other stakeholders to think about how to engage and use stakeholders to really advance cancer control interventions in Kenya. And I think the most important aspect, picking up on what Mishka spoke about, is being very transparent. I think that's really helpful in terms of gaining trust and having stakeholders believe in their role and in their, the powers that they hold in terms of collaborating with you in moving things forward. So it's really important to really be transparent through the engagement. And what I have seen, or maybe from my experience, what I saw work what was very productive is not just identifying and analyzing these stakeholders, but being very strategic and being very thoughtful in how you bring on board these stakeholders. And I think everybody wants to be valued, and everybody wants to feel that their contribution matters. So one, maybe coming from an institution that was at the policy level at the Ministry of Health, one effective way of one effective way of of ensuring that stakeholders were actively engaged is to having deliberate platforms in which to engage these stakeholders. And these platforms, I think what really helped was to make sure that they were diversified. Typically, I think when you think about engaging stakeholders, sometimes we only think about bringing them together during World Cancer Days or some of these commemorative activities. But sometimes what is really valuable is to ensuring that these stakeholders are involved even in other in the whole multiplicity of cancer control interventions, particularly when they feel that their voice matters. So in my case, I remember we would involve stakeholders even in terms of policy development. So when you're developing the national cancer control strategy, ensuring that these stakeholders are engaged right from the word go, so that as you're developing your priorities, as you're developing your action plans, they're right on the table. Engaging them also in terms of spreading the messages or using them to spread the message to the people that they work with, because they have different areas of influence. So some of them are very strong at the community level. Others are very strong in the financing space, so they are more in touch with the the financials even more than you are the Minister of Health. So I think that was really important in terms of engaging them based on their strengths. And another key important thing is information sharing. I think that comes out very, very, very strongly in terms of ensuring that these stakeholders that you have brought together, that you have engaged and you have created a relationship with, how are you sharing information with them on a continuous basis, so that through this open communication, through this sharing of information, they they see where they fit in, and they even contribute to ideas on how, as a country or how as a ministry you can push some of these things forward. So I think these are probably some of the things that I have seen work, ensuring that really that communication is very clear, that transparency is really, is very well maintained, and also ensuring that you engage the stakeholders, which I think comes from what Dr. Sharon talked about, analysis, ensuring that you apply the stakeholders based on their strengths, based on their level of influence. That that will obviously translate into results that that help you advance your various initiatives. I hope I have been able to address the question.
Thank you very much. I can see that there is another question from Ikram. A question to Dr. Nasrin. I don't know if Dr. Nasrin, you can respond. He's asking, when you identify conflicting sector stakeholders that are equally important in your advocacy, as you identified for example, PNAM and the Ministry of Health, can you share tips about best way to address this? They have conflicting interests or they are equally important in your advocacy. What do you do? Dr.
Okay.
Nasrin, I don't know if you are still okay.
Yes, I'm here. Yes, no one tells you that there is a conflict, obvious conflict between two stakeholders or two organizations. No one just gives you this gift and it's okay, everyone knows about it. But when you are getting close monitoring to your stakeholder, as we classify them highly important because they have a lot of interest and a lot of influence. You get close understanding of them. You ask about them. You do meetings with them. You ask them always questions in order to understand, and then you will by yourself, if you are very passionate about your project and clear about your project, you will identify those conflicts. It's conflicts that doesn't mean that it will blockade the system, but you have to respond to the needs of every one of them. Everyone is willing to participate. But if you do not pay attention, you know that they may be a bit don't want to engage and less engaging with you because they are afraid of this non-verbal problem they have. They will not express it clearly. It's not a problem in itself once it's identified. I don't have a specific tips. You have to know your ecosystem very, very closely. You have to have a big relationship and communication skills in order to accommodate. And once you are on table with both stakeholders, you talk openly about the subject. It shouldn't be a taboo or something that is not considered. Sometimes you even make it the second or the third topic that you should discuss, because this is a very important topic. We know that we have a conflict and possible particular situation regarding the money, for example. So let's talk about the solutions, what we can do about this. So if you are openly talking about it, everyone will express their concerns and you can solve them together. Transparency, as said my colleagues earlier, is very, very important. People need to know that you are engaged, transparent, that you know your strengths and pitfalls, and that you are willing to work with everyone in order to attain that objective.
I hope that I responded to your question.
Dr. Sharon, you would like to add something?
Yes. So just also want to give, I'll move away from tobacco. I've had, when we started the cervical cancer screening program in Zambia, we realized women were coming late. One of the reasons, not the main reason, is that they would first go to the traditional healers before they would go to the hospital. Okay. So when you look at the stakeholders, the traditional healers start looking like they are going to be in conflict. They are making these women stay longer instead of knowing that this is not what they're specialized to do. And after a lot of analysis, we realized that one, women go there because they feel respected in how they are treated in those clinics than the other side. Two, there are cultural aspects that women, the way they were thinking of the cause of cancer as, because the myth is that you slept with somebody's partner, especially a wife, a legal wife who's not happy. So they kind of make you start having excessive bleeding, which doesn't stop. And it was very strong. So because they thought this didn't have anything to do with medical reasons, but I'm having vaginal bleeding because of that relationship I had. And it can only be cleared by a traditional healer than the doctor. The doctor don't understand these cultural, spiritual setting, of course. And so you need to understand where that's what you assume to be opposing is actually coming from, or why there's this negative, why you're thinking that our patients are going that side. So these are not in line with what we want. Sometimes it's digging deeper with what is actually happening. So which means the way you are going to solve that is through, one, raising awareness as one of the ways to reduce on that lead and giving information to people about what actually causes cancer of the cervix and myths that exist, and getting the women engaged and we actually got the traditional healers to the table, and they told us, and one of the reasons we don't want those women to come to your clinics is because they are told we're evil, we kill women, and what. That's what the doctors were telling the women. And the women go back and report to the traditional healers. And they said, okay, so that's what they think about us, that we are the wrong ones. But we've been practicing this since we were, yes, you understand that they're not going to cure cervical cancer. It needs to come to the hospital. So the best way is also getting them on the table, getting the women on the table. When you get them, then we had this discussion. It was not a one-off way, and it shouldn't be. Engagement is not about me as an advocate or as a doctor thinking I'm right, they are wrong, so I should tell them what to do. It kind of just blocks that exchange, and they'll continue what they're doing. But making people like, I want to find out, what is it? How is it done? How can we work together? And it's not a one-off, it's a continuous process that you start engaging into. You just want to reduce the time they're spending with women. And so, look, if you find a woman is bleeding based on what we've discussed, it could be cervical cancer. And you said you don't cure cancer. Any woman who's bleeding, maybe it could be cervical cancer. Can you send them to us after you see them? And that becomes the discussion. You see them, send them to us because it could be cervical cancer, and then we'll do what we know with women who have cancer of the cervix. Thank you.
Thank you, Dr. Sharon.
Thank you, Dr. Sharon. Yeah. I don't know if there is no more question. Maybe we can share the video of Dr. Zina. Yeah. Unfortunately, Dr. Zineb is traveling and she couldn't join us, so she sent us a video. Dr. Zineb is the president-elect of the Union of International Cancer Control and the first African in the road row, which she promotes equity cancer care globally. So maybe I can share her video here. Yeah. I don't know if it's okay. Oop. Yep. Mm-mm-mm. It's okay. It's okay.
We
Yes,
can
Do you
see
can
see
it,
you
my
but
go
it's
back to the
buffer. It's
beginning?
buffering if
Yeah.
you want to
Okay.
start it. Yeah, thank you.
Mm. The volume, can you increase the volume if possible? I don't know if everyone has trouble hearing.
It's not clear.
Sorry?
It's not clear.
Yeah.
It's not clear.
No.
Ella, let me try if
Okay,
it's
try
possible.
it.
Tell me if you can see my screen, please.
Now, yeah. Yes, we can see it. So just start the video.
Okay. Can you hear it?
No. Volume. I think you need to work on the
Okay.
speakers.
Can you hear now?
No.
No, we don't hear it at all now.
Oh.
It has to be
Okay.
something about changing the speaker input, I believe.
Yeah.
Okay. Oh, so maybe someone should try.
Caroline.
I will try.
Okay.
Sorry, everyone. Bear with us for 1 minute. We do want to definitely hear Dr. Zineb.
Greetings to everyone on this very, very important webinar.
Now it's clear, but we can't see the
Yep.
picture.
Yep, hang on 1 second and I'll get it both together. I'm in Bangkok, so hopefully.
Very, very important webinar. Let me start by congratulating the organizers that are bringing together Voices for Impact in Cancer Equity Voice, in particular the steering committee chair, Dr. Samira. Thank you for the invitation, and I hope that my little contribution will help to make an impact. I'm going to briefly go over the steps, or should I say, my own views in how to engage stakeholders and why it matters for cancer control. Stakeholders constitute a very wide range of different groupings and organizations, professionals when it comes to cancer control. And why does it really matter? is the systemic process of engaging different individuals, groups, and organizations who are interested or affected by cancer control. The decisions that we need to make, how do we need to make them, what policies we need, what projects, and how to implement them. There are really a lot of comprehensive solutions, and also we have to consider resource mobilization and, most importantly, the sustainable implementation of all these methods that we come up with. We must understand that cancer control is bigger than just one organization, person, individual, or groupings. It constitutes a whole range of different stakeholders. The first thing that we need to do is to map the relevant stakeholders in any country or parts of the world, either high or low middle income. There are pertinent stakeholders that must be engaged, and these include government and policymakers, media and the creative industry, civil society, and non-governmental, under which we have patients that have lived experience, as well as those who are implementing different types of programs that come into place along the spectrum of cancer control, from prevention right up to palliative care. As an advocate, this group of stakeholders is really very important to me, and I am sure that a lot of the people that are attending this webinar will constitute that particular block. Then we have the private sector, survivors, which can also be considered on their own or as part of the civil society organizations, international donor bodies and organizations, and partners like you have the WHO, we have the Union for International Cancer Control, IAPO, and so on. There are a huge amount of international organizations that not only support, but help us to create the right policies that we need for effective cancer control in our countries. Now, what strategies can we employ to engage these stakeholders? It's really quite, I'll just give a broad overview, but everything must be taken in context of your own particular situation. I could say relationship building. For me, in my own environment, relationship building is not just about engaging governments at high-level meetings, but it's also about grassroots communication with the community gatekeepers like the traditional and religious rulers that are really a voice for the people that we're trying to get the message to. Yes, we engage at a higher level with the governments and donor bodies, financial institutions, but the pertinent group, the important group that is often overlooked when we're putting together our plans and so many other interventions for cancer control, are those at the grassroots. And to reach them, we have to engage the right stakeholders. So like I was saying, the strategies to engage stakeholders encompasses relationship building, leveraging on media, facilitating convening, and also a continuous assessment of what we are doing. How do we build and maintain relationships? To build and maintain relationships, we need to, first of all, understand the needs and expectations of the communities, identify the key stakeholders that are involved, and the method through which we are going to communicate effectively to the target audience. Formalized partnerships are very important. We can engage, but if we don't put things down in writing, it usually tends to get lost along the way. So formalize under MOUs and documents that will help us to really map and assess what we're doing step by step as we go along the way. All this will help to establish trust and also to boost our eventual outcomes. Facilitating stakeholder activities, which is one of what's really what we're doing here, involves convening strategic forums. A lot of meetings go on around the world all the time, having to do with cancer control. And not everyone is always really keyed in to what is happening. And sometimes we get bored and burnt out. But like I always say, we must not. We must continue to engage and provide the platforms through which we can share experiences. The Union for International Cancer Control has one of its key pillars as convenience, and all the meetings that are hosted, these, the World Cancer Leaders Summit, the World Cancer Congress, the Cancer Planners Forum, tends to bring together people, organizations, members, as well as non-members from across the world to come together on a platform to exchange ideas and learning experiences. What can we learn from each other, and how can we put that into our own local programs? Communication methods are also important. Today, we have the use of media, digital media, which enables us to communicate strategies and what we're doing more effectively. But understanding how to use these tools is important. And there are also simple courses, online courses that we can all engage in particular for the civil society members that can engage and learn from these online courses, effective media communication, in particular in this digital era that we're all living in. And it's not just about the engagement, but we must balance the different groups that we're engaging. By balancing, I mean that we do not just focus on the large forum that we have internationally or even at a national level, but involving one-on-one engagement. If we have a large meeting and we do not know a really global platform, and the stakeholders or the relevant persons that should know the outcomes of that meeting, if it's not transferred to them, then we really haven't done much. So every engagement, every forum, every meeting should have a simple outcome documents, and this should be effectively disseminated across a wider group. One-on-one engagement at the local level is also one of the points in this area. It's important that we listen at the fora. When we engage, we should listen and find ways in which we step out and lay out the response process. By listening, we've heard the issues, we've heard the positives, we've heard how easy it is to get a screening across to a certain group and how difficult it is to get to the other group. So responding to the different needs of cancer patients as well as those that are involved in the control process is also a key step. And like I said, documenting all these programs. By documenting, we have it written down and other groups can always go back to it. So it's not just, oh, we've done it, we've said it, but by documenting it, we have the opportunity to make it a learning process that everybody can effectively benefit from. I've spoken a bit about the media. Media is a huge strategic stakeholder when it comes to health information, creating awareness, fundraising, and so many other knowledge building ways. Media does not just involve digital media, but the conventional means of media, having platforms that put together the journalists that are involved in the media space and engaging them, teaching them about what's really the messages, the key messages that they should be passing across. And I'm pleased that there are many civil society organizations that value this and start with it. At the First Ladies Against Cancer of Nigeria, this is one of the programs that we have run. bringing together our program officers, the media officers, and teaching them effective engagement, how to target the stakeholders either online or through conventional media, how we can make reports and write-ups, articles, and how to disseminate it. We had a very useful capacity building session for these officers in 2024 that really helps to boost the and amplify the messages that FLAC is sending out across the world and as well as locally. So media is really quite important. Assessing what we're doing. If we continue to do these, make these steps without assessing as we go along the way, then it can be a problem. We track the process through different tools. Again, there are many tools that are available absolutely free of charge, and we can download them and evaluate the results. By having data, then we know that it has happened. If you don't have data, if you do not put the data down, then it really hasn't happened. So tracking the results, evaluating, reports the outcomes, and adapt the outcomes so that we can improve cancer control generally. My last message is that we need to understand that engaging stakeholders is not about adding more partners and building a very big list of, my organization is associated with this person and that person. It's really about ensuring that every partner has a relevant and meaningful seat at the table where the decisions can be made. And most importantly, we value their input and take it into consideration. We assess the outcomes and we put them into our work plans while we're implementing. So I hope that my message is clear. Stakeholder engagement is key in cancer control. It is not just a one-man process or a one-man show. The fight against cancer requires all of us, multiple stakeholders, and the commitments that we all bring to the cause and the passion with which we engage our various partners is what determines how much we're going to reduce the impact of cancer on the patients living with it, as well as their wider relatives and support groups. I thank you for listening. I'm sorry I'm not on live, but my email will be shared on this webinar, and I'm very happy to take any questions and engage with the different participants one-on-one. Thank you.
Wow, fantastic. Thank you so much. I just want to summarize some key takeaways from what we hear today. Cancer control is a work that needs to be implemented by multiple stakeholders. And stakeholder mapping is not just a tool, but a strategy for a bigger impact. And I can remember that a lot of the speakers talked about engagement strategies that require clarity, communication, evaluation with continuous documentation, transparency, and sustained relationships. And also don't underestimate the value of non-traditional allies and people with lived experience. So thank you so much for all these insightful conversations. So what's next? You will all receive a post-webinar email with a link to complete the feedback form in order to receive your certificate of participation. We will send you all the session materials, the links, and additional readings by email, in this email. And you will also have the recording of the previous webinars to be able to catch up if needed. Webinar 4 will be on Tuesday, September 2nd, and we will focus on turning advocacy into action. I would like all participants I would like to inform all participants that those who have completed the 4-part webinar series will be eligible to an in-person voice to participate to in-person voice workshop at our Awartic 2025 in Hammamet, Tunisia. And I'm sure Ella, Professor Nasrin, and their colleague look forward to welcoming us, all of us. And I would like, on behalf of the Voice Steering Committee, to really say a big thank you to our speakers. You were fantastic. Thank you to the interpreters. Thank you to all of you participants. And let's continue building this movement for equity in cancer care in Africa. Without overdue, I want to ask if Caroline or Ella don't have anything else to add. We can just end the session today. And thank all of you for attending.
Thank you, Samira. Thank you, everyone, for attending.
Thank
you.
everybody
Good
for
night,
everyone. Always feel free to
Bye.
email more questions. Thank you so much.
Thank you.
Bye.
Thank you. Bye.
Thank you, everyone. Bye.
I can't hear Maria.